Hello and welcome to this short podcast on a recently published scoping review in Developmental Medicine and Child Neurology entitled The Longitudinal Relationship Between Hip Displacement and Hip Function in Children and Adolescents with Cerebral Palsy. My name is Dr. Ailish Malone. I'm a Senior Lecturer at the School of Physiotherapy, the Royal College of Surgeons in Ireland based in Dublin, and I'm also the Research Programme Lead for Physical Activity and Rehabilitation at the CP Life Research Centre. I'm presenting this podcast on behalf of my co-authors, Dr. Georgia Tanner from the School of Medicine at RCSI and Professor Helen French, Associate Professor at RCSI. We did this study because we wanted to explore what was known about the relationship between hip displacement and hip function. We know that children with cerebral palsy have normal hips at birth, but 1 in 3 will develop hip displacement. Displacement is defined as lateral displacement of the femoral head out of the acetabulum, and it occurs over time. We know that the risk is higher in children who have severe gross motor function limitation, who have spastic or dyskinetic cerebral palsy, and we also know that the risk is highest between the ages of 2 and 5. However, there is a gap in knowledge about how hip function changes over time in children with cerebral palsy with respect to that displacement. So our aim was to identify, describe and synthesize the available evidence on the longitudinal relationship between hip displacement and hip function in children and adolescents with cerebral palsy up to the age of 18. The exploratory nature of the research question and aim meant that a scoping review was an appropriate method of evidence synthesis for this study. We used the Arcasy and O'Malley framework and reported our findings using the PRISMA scoping review checklist. We searched multiple databases, 2 authors conducted title and abstract screening, and 2 authors also independently reviewed full text for eligibility. We extracted data and cross-checked for validity. To be eligible for inclusion in this scoping review, primary studies had to include young people with cerebral palsy who were younger than 18 years at the first point of data collection. They also had to report validated outcome measures, at least one validated outcome measure in 2 categories. The first category was to measure hip displacement radiologically using Reimer's migration percentage or other validated measure. The second category was to measure hip function. This could be an outcome measure on at least one domain of the International Classification of Functioning Disability in Health, or ICF, and it had to be a validated measure. The studies also had to collect data on both function and displacement at 2 time points that were at least 1 month apart, and this criterion was necessary to address our research question on how displacement and function change together over time. We excluded papers that reported single case studies or small case series, and we also excluded papers that were only published as an abstract or protocol without a full text report. In terms of results, the PRISMA flow diagram is shown here. From an initial search that identified 2017 records, we ended up with 29 eligible studies that are included in the review, and I'll now describe the key findings of these. The first key finding was that the majority of studies involved an intervention. There was a mix of study quality. 12 studies were retrospective, 16 were prospective, and there was 1 randomized control trial. Only 2 studies did not include an intervention. These were 2 prospective registry studies. So this means that we know quite little about the natural history of how hip structure and function change together over time. The retrospective nature of some of the studies means that the quality of evidence is possibly low. We did not conduct quality assurance or quality appraisal as this was a scoping review. However, the retrospective method of extracting data from healthcare records is prone to error unless standardised protocols are in place and adhered to. This figure shows the numbers of studies that reported interventions and the category of those interventions. So as you can see, most of the surgical studies involved bony surgery, followed by soft tissue surgery. 5 studies reported the effect of botulinum toxin or nerve block injection. There were 4 studies of rehabilitation intervention, and then 3 studies were of multiple interventions. This graph also shows the ages of the participants enrolled in the study. Children who were of preschool age are shown in light blue, And children who are of mixed ages are shown in the darker blue colour. A mix of preschool and school-age children is shown in studies in the orange colour, and then school-age children are shown in grey. So, for example, bony surgery here was reported by 9 studies across a mix of ages. Second key finding was that participation outcomes were underrepresented among the functional outcomes. This diagram shows the number of studies that collected data on each outcome measurement construct. The most commonly measured functional outcome was range of motion at the hip, followed by pain, which was measured by 9 studies. 3 studies reported outcomes using the CP Child questionnaire, and then there was a mix of studies that also reported on spasticity or gait, but little contribution in terms of participation. So our study concludes that current evidence gives limited insight into the relationship between hip displacement and hip function as children with cerebral palsy grow and develop. There is a need for more high-quality prospective studies, ideally conducted through registries or other standardised method to address this question. Thank you for your attention.